So you have seen that pyrimidine metabolism, any defects in the pyrimidine metabolism, it leads to all sorts of medical complications. But as far as pyrimidine metabolism is concerned, their defects are not as challenging as the case of purine metabolism. I mean, they are not as diverse either, because of the reason that pyrimidines are very highly soluble in your body, and they can easily be excreted through your kidneys. So as a result, the clinical consequences of the defects are not as diverse in the case of pyrimidine, or in the case of pyrimidine metabolism more accurately. However, there certainly are some of the disorders, one of which I will share with you, that is hereditary uric aciduria. As the name shows, it happens because of the accumulation of uric acid in your body, and that is a result of the mutation in the UMP synthetase. Either it's deficient, this enzyme, or it cannot perform its function well because of the mutation in it. And as a result, as I've told you, there are more and more uric acid which can also be found in your urine. One of the ways to treat it with the uridine. So if you administer your body with uridine, what will happen? You can minimize the effect of this disease. How? Because when you add the uridine, then body don't have to depend upon the conversion of uric acid into UMP, because you already have provided the uridine. Then uridine can easily be converted into UMP without the help or without the need for an active function of the UMP synthetase. So in this way, the deficiency in the UMP synthetase can be circumvented. Then there are certain complications which arise because of the disease. For instance, OTC deficiency in urea cycle. What happened? The OTC deficiency, that is the ornithine transcarbamylase enzyme. As a result of this, transcarbamyl phosphate cannot be converted into citrulline, because it combines with the ornithine to make the citrulline. The citrulline is not formed. So as a result of this, what we say, the deficiency of OTC, what will happen? Then there is increased availability of the carbamyl phosphate, because it is not being converted into the citrulline because of the defects in the OTC enzyme. So what will happen? The carbamyl phosphate then will rather be used in the formation of more and more uric acid, and that more and more uric acid will become accumulated specifically in those patients who also have the defect in the UMP synthetase enzyme. So in this way, you can see how one defect can make the things complicated if you have also other defect, because many pathways interact with each other, and as a result of this, any defect in one pathway can also make the things worse if another pathway which is interacting with that pathway, let's say if pathway A has a defect and pathway B has also an defect, and A and B both interact with each other, as here is the case when we are talking about the UMP formation, and we are also talking about the citrulline formation. Here again, the defects in UMP synthetase and defects in the OTC deficiency, they both make the things even worse. This is how sometimes the things become more and more complex. That's why such situations are much more complex to deal with.